Thank you, Mary Lee. I was kind of surprised by Dave's comment, and then it hit me about 10, 15 seconds later yesterday on his radio show. I did invite the audience to come for this week and next week because it's entrepreneurial related. I'd be surprised if he has 52,000 listeners. I know he does well, but that's awfully good.
I'll remember that.
He shipped to New York and Chicago.
Oh, okay. You can't get it over the internet. I forgot about that part. It's my pleasure today to introduce our speaker. I had no idea it was National Hospital Week or Physicians Week or Doctors Week when I set this up, but Bo Wilkes is the president of Ballad Ventures, which is the wholly owned subsidiary of Ballad Health. He is also managing director of the Ballad Health Innovation Center. Bo is a Johnson City native. I had the pleasure of knowing his parents. His late father was a very active volunteer in the community. 3 times was chairman of the Park and Rec Board. I served with him on the Mountain States Board for a while, and he was very active in the Mountain States Board at that time, plus a number of other things he did. And but Bo is a graduate. His BS degree is in health science from Clemson University, Lynn, 2005. He also has a master's in public health from ETSU, and he also has a certificate of innovation from the University of Michigan's Engineering School. For his present role, he served as the chief of staff for executive chair and CEO of Ballad for sure, but I think you also served with the previous CEO at Mountain States too. He also served in other roles dealing with hospital operation and strategic planning. During his current role, he's been responsible for developing the Ballad Health innovation and venture strategies. And while I look forward to seeing how much Ballad Ventures can help improve the public health of this region, I also feel it's very important for the entrepreneurial ecosystem of this region to have somebody like this in the field. I'm going to let Bo introduce his speaker. We have the added pleasure of having an extra speaker today, which I think all of you be interested in, but he'll introduce Rebecca and say anything about her if he wants to, but it's my pleasure to introduce Bo Wilkes.
I'll grab that from you.
Yeah, you can do that, Bo.
I can always thank compliance for being able to lock these computers very, very quickly. So apologies for the technical delay there. Thank you all for the invitation to be here, and really excited to kind of share our story. It's a new vision, but a lot of great opportunity, not only for our health system, but also this region as a whole. So I'll kind of start with the background and the story of how we ultimately got to where we are. So currently, Ballad Health utilizes a technology called SmartSquare. And so SmartSquare is nurse staffing optimization, but also provides the ability for our nurses to pick up extra shifts as they see that they're available. This technology was brought to us several years ago, and it had a wonderful vision, but needed a little bit of course correction. And so our leadership at the time provided that course correction, really leaned on as one of the first operational contracts, and ultimately helped that company grow into what it is today. It was then acquired for over $100 million, and we got a really nice thank you note in the mail from those entrepreneurs. And so that really started to set the stage for how do we actively participate in the transformation and disruption of healthcare, but then not only from a strategy side, how do we financially benefit from that? And so that really started with the vision of what ultimately created Ballad Ventures. So what is Ballad Ventures? So Ballad Ventures is a corporate venture capital subsidiary. Said another way is we invest in early stage healthcare startups that ultimately align with Ballad Health's strategic strategy. So how can we improve the cost, the quality, the experience of healthcare in general. And as we all know, healthcare is somewhat broken, and so we want to actively participate in that transformation and disruption for the betterment. And I'll talk a little bit about what that means and the applicability of that, but in essence, what we do is we have a $10 million investment that's pulled out of our investment portfolio, and we invest somewhere between $500,000 to $1.5 million in healthcare companies that are valued somewhere below, let's call it $50 million. And so that then in turn gives us equity in that company. In some respects, we participate on their board, but we help in a variety of different ways. Not only do we try to deploy it operationally and actively participate in the value that brings the organization, but we also help them with business development, help them with operations and strategy from time to time, governance, in a variety of different roles. And so myself and my managing partner who lives out in Salt Lake City kind of balance that. And so, there's a vibrant ecosystem on the West Coast, there's a vibrant ecosystem on the East Coast, and so we can divide and conquer in a variety of different ways and ultimately bring that value back to Northeast Tennessee and Southwest Virginia. I mentioned that we have a strong strategic alignment with the organization, and that's very important. We don't want to be looking at, investing, participating in opportunities that don't already involve what we're doing today. And so as we think about where healthcare is going and ultimately where the strategy of Ballad Health is going, we want to actively support and participate in that. Not only what's on the leading edge and potentially could disrupt our current operations, but beginning to shift and transition where our strategy and focus for the organization is going. And so with that, kind of two key areas that we're really focused in on, the idea of digital care or care anywhere. COVID really escalated that. And so as you think about the ability to pick up your phone and order a script from Walgreens, or be able to FaceTime with your physician, or just a variety of different roles, even texting these days, that opportunity becomes available. So thinking about and understanding what's out there and participating in that. So again, investing, evaluating, deploying in a variety of different ways. The other big thing is workforce, and that can happen in a variety of different ways. You can look at things like artificial intelligence that I'll talk about here in a little bit, but also then simple staffing solutions. And so these are things that we're constantly working with our key stakeholders internally to understand what their pain points are and what their strategy is, and then going out into market and understanding what's going out there on a global scale, not just a national scale, but on a global scale, and beginning to provide those ideas and those opportunities internally for us to evaluate, vet, and ultimately potentially select a partner there. So one of the big things about kind of ventures and innovation in particular is by the time it hits a newspaper, Forbes, Wall Street Journal, whatever it may be, the radio, it's kind of already main stage. And so what you really need to understand is what are the conversations that are occurring behind the scenes as companies are what they call stealth. They're in the stealth mode, they're in the startup phase. That's where we really want to start our conversations. And so our syndicate partners become vitally important. And what I love so much about up here is we are true partners. We don't passively participate in these conversations. We are, in some respects, leading conversations with some pretty significant healthcare systems. I mean, you look at Providence up in the Pacific Northwest, they are probably one of the more innovative healthcare companies in the country because they compete up and down kind of that Pacific coast there with Microsoft, with Google, with a variety of different things. And just being able to have the conversation, understand what they're seeing, and bring back some ideas for us to adapt and change and ultimately deploy is really exciting. You look at the stars in particular, Orlando Health, Rex Health Ventures, which is UNC Health in North Carolina, MedStar, University Hospitals, OSF, Providence, Memorial Care out in Orange County. All those stars represents deals that we've actually done with these companies, some of which we have led, some of which we have partnered, but that just really begins to show you where Ballad Health is and the ability that we have to contribute to the healthcare ecosystem, not just to what's going on here regionally. And that's, I think, I want to stress that because we want to become a leader. We don't want to react and adapt to where the industry is going, but how can we truly be at the forefront of where healthcare is going, and for us to be thought leaders in a variety of different ways. And so this map is just always significant. We meet with these folks at least monthly, no less than quarterly, and so there's a constant dialogue and conversation that goes on around a variety of different topics. So I think this is really where the rubber meets the road and allows you to really begin to understand what it is we do and how we do it. And so these next two slides are our current portfolio companies. And again, you'll start to see the ties back to what we do and potentially how you access some of the services that we provide. So Evidence Care is a clinical decision support tool that embeds within the electronic health record. And so what that means is, as a physician is in the electronic health record and determining a admission status, whether it be to inpatient or observation, which gets a little tricky from time to time depending on, insurance, what day of the week, what the weather is outside, just a variety of different things. This tool actually provides the value for the physicians to be able to go into that tool and literally check boxes, and then it automatically writes over into the notes so that insurance gets the correct information and can reimburse not only for the healthcare system but also for you as the patients. In addition, they're starting to build out a suite of products. They have a new product called CareGauge, which basically takes our cost accounting system and integrates it into the EHR and allows the physician to understand the impact as they're ordering tests, what the cost of care is to the patient. And that's very important. So as we talk about impacting the cost of healthcare, understanding what the cost of healthcare is important. Evidence Care allows us to do that. The second one is a company called TaylorMed. So they are an Israeli-based company. So I mentioned globally, again, very important. Israeli-based startup that we've partnered with Providence, OSF in Illinois, and Rex Health Ventures, UNC Health in North Carolina, to invest. But what it does is it automates our medication assistance program. So we have about 16 FTEs, employees within the system, that all they do is they help patients seek access to get payment for their medication. And so they're going to the Pfizers of the world or whatever other pharmaceutical company you can think of, and they're helping get access to that. Only about a third of that comes back to the health system. The majority actually goes to the patient, again, to help them make sure that they get the medication that they need. What TaylorMed does is they begin to automate that process. So right now it's a very manual process. They are constantly going out into the web, going out into these servers of these pharmaceutical companies and pulling in the data. This company actually allows that automation to occur. The third company is actually a relatively local company. One of the co-founders is from Piney Flats, but the company was originally developed at University of Tennessee, Knoxville, right down the road. But it's a simple, novel, two-part needle that comes apart, and it allows you to do a number of different stitches and techniques within orthopedic surgery. So the idea was originated around ACL repair. And so to do an ACL repair, this is non-clinical, I'm very non-clinical. You basically have to go through the tendon and around and then back through that same hole and around again before you move on the stitch to make sure that you're encapsulating the tendon in ultimately the ligament in the repair of the knee. This entrepreneur decided, why can't we take the needle apart and create a sheath so that I can pull it through and then break it, bring it back together, put it back in the sheath, and pull it back through again. And so they've done this. They've received a lot of funding from the National Institute of Health and just a number of different things. But I think this really speaks to some great local entrepreneurship and the ecosystem that we're trying to build with folks like SyncSpace, Founders Forge, ETSU, Holston Business. There's a number of different opportunities there that I think everyone's starting to line on, so that's exciting. Two other portfolio companies. Cincinnati is a cybersecurity company, and one of the biggest threats to healthcare is obviously a data breach. I think over 80%, and that's probably being conservative, of data breaches occur through third-party vendors that are accessing the system of Ballad Health. What Cincinnati does in real time is they actually help vet and do a lot of that work that we currently do internally. And not only do they do it for us, but they do it for all their partners. And so that's a big benefit. In addition, when there is a data breach, while we're reacting to it, they understand what the root cause is, and they push that information almost immediately to the partners. So in real time, folks understand what's going on and they can react to it so they're not vulnerable and susceptible. So there's two-way value that exists for us. And then the last company is 410 Medical, and I'll touch on that in a couple of slides, but really innovative medical device company that is helping with sepsis, and really it's the rapid transfusion of fluids into a patient. And again, I'll touch on that in a minute, but a wonderful partnership that's having impact here in Kingsport. So switching gears just a little bit, we talk a lot about just the investments and the financial aspect of things, but the operational and true innovation of things is really, really important. And by the way, I hate to be landlocked, but I'm trying to be respectful to everyone I'm more like a professor where I like to pace and everything. So forgive me for kind of getting a little wiggly here, but I want to be respectful to those who aren't able to attend. So the Innovation Center is a really unique and interesting idea. And so again, how do we not only think strategically about where healthcare is going, but then actively participate in that? So really it's around three verticals. I just touched on really developing a vibrant ecosystem within the region. Within a healthcare perspective, we're doing a lot of work, and we ultimately feel like in a number of different ways we can be a leader within healthcare as far as innovation and the entrepreneur ecosystem is concerned. I would say that we don't want to lead that effort. In fact, we want to actively participate in that effort just for a variety of different things, because we want to stay very focused in on what we're doing. But we also want to make sure that the entrepreneurs locally have a way, especially within healthcare, to access us, have conversation with us. If they need data, if they need a pilot, or just a number of different things, they can reach us, and that's one way in which we can do it. The second one is at the top there, and it's this idea of inside-out innovation. So if there are ideas, and we have a lot of brilliant people across this region and then ultimately across our organization, as we have ideas internally, how do we vet and evaluate them and ultimately determine whether or not we potentially could scale them? Because if there's an opportunity to be able to do that and partner, what a wonderful way to actually bring the innovation up out of Ballad Health, out of this region, and push it out into the industry. We're just really kind of starting that work. About a month ago, I hired on a head of innovation for the Innovation Center. So really excited to do that. Gentleman, his name's Pat Ryder, came from Eastman. He used to run corporate development for Eastman. So really excited to have that local tie, that experience, and also challenge of coming from outside of healthcare so that he can ask simple questions that sometimes we take for granted. And then the middle one is probably where we're most active, and that is this idea of outside-in innovation. So how do we partner with entrepreneurs, pull them into our system, have the value for our patients, for our system, for our communities, and ultimately help them grow and scale their company? And so we can do that in a variety of different ways. If I can find the clicker here. So one of the ways is through medication safety. And so we're not finalized with this one yet, but we're very close to the finish line. So I'm happy to kind of hit the highlights, but I'll remain vague on what the company is. But this is an Israeli-based company that focuses utilizing artificial intelligence to medication safety. And so the idea behind that is, how do you begin to connect all the equipment to the patient and the EHR in real time to make sure that medication safety is of the utmost importance? The example that was when we originally started exploring this opportunity was, we have a lot of smart devices all around us that actually we aren't leveraging to the fullest extent of their capacity. And so what this does, as an example, if you're in the hospital and you're on a medication pump like the Baxter smart pumps that we have within our facilities, and all of a sudden you have an event that happens, in real time it looks at your vitals, what medication you're on, the EHR, and can quickly discern what that event is and can flag the pharmacist. And so while the nurses and physicians are running in for that acute care event to stabilize you and take care of you, this software is in the background really supporting you and getting to the pharmacist to flag and ultimately make sure that we're making in real time the medication adjustments that's needed, up, down, suspending, whatever it may be, to do that. The exciting thing about this, Trish Tanner, our Chief Pharmacy Officer, is leading. We're going to be the first health system in the United States of America that are going to have this software. And so that is really, really cool. Furthermore, the company is paying for us to do the build out. They're giving us equity in the company. And as we scale, we ultimately get a larger share of the company. And so it's a win for our patients, it's a win for the financial viability of Ballad Health, and it's also a win for this healthcare startup. And so these are some really creative and unique ideas that we can do to ultimately pull in to Ballad Health. And then the last one, I mentioned 410 Medical, and this is 410 Medical, and this is impacting Kingsport. And so I want to finish with this slide. 410 Medical, as I mentioned, is a medical device. It looks like almost like a gun. So again, it hooks up to the IV, and you can rapidly get fluids into the body in a way in which we've never done. So we originally were piloting this at Niswonger Children's Hospital, and Ballad Ventures actually came in on the backside. So Niswonger was leading this effort. Within the first about month, we had a patient present. She was going into septic shock, and we were able to get 2 full bags of fluid into that patient within about 20 to 30 minutes. Normally that would take almost an hour. The physician that originally told us this story said, in the past, that same event would have resulted in that patient ending up in the ICU and a very different outcome. Instead, 3 hours later, she was sitting up in a chair. 4 hours later, she was discharged to the home. That's impactful. So that was a pediatric device at Niswonger, and we started exploring with some of our partners, OSF in particular, how do we scale this to the adult population? So working with Dr. Beth Jackson, our Chief Medical Officer at Holston Valley, also a general surgeon in town, and Dr. Amit Vashist and Dr. Lauren Pye, we ultimately began to scale this at Holston Valley. We've done that over the last 90 to 120 days with tremendous success, impacting lives here in this community. And now we are starting to scale at JCMC and Bristol Regional. And so again, really great opportunities for us to not only participate financially, but also help this company continue to grow and validate now in the adult population and change lives, as well as give real-time feedback to how they can improve their device and ultimately grow and scale their company. So I wanted to be very brief, provide some examples, especially about what we're doing. It can get very complicated. Really look forward to the Q&A and would welcome those conversations. But it's my pleasure to introduce Rebecca Beck. She is the CEO of Holston Valley and Indian Path here in the Kingsport market. And so I wanted to provide her a little bit of time to kind of give you some updates on what's going on in Kingsport.
All right, thank you, Bo, and it's a great opportunity, and I'm delighted to be here with you today. I've been with Holston Valley now for almost 5 years, and really just excited about some of the things I'm going to share with you today, and most recently some new developments that, in addition to what Bo has just shared, that are happening here in Kingsport as well. So I wanted to just give updates on some of the key projects that some of you may be aware of in Kingsport. At Indian Path, we are well on our way with the renovations of our women's and children's department and unit there in the facility, a nearly $7 million renovation project as we've consolidated our berths for the city at Indian Path. We will finalize phase 1 of that project at the end of June, and then expect to have the entire unit at completion and ready for opening just after the first of the new year. So we're very excited about that. Also, many of you are aware and very familiar with our pediatric emergency department at Indian Path. We opened that in October, and we're just shy of 5,000 visits now. So it really shows the need for our pediatric access here in the city and how well thought of that's been by our community and those with children who need that access. It's currently only open for 12 hours a day from noon to midnight, but we will soon, hopefully by July 1, have that up and ready to be 24/7 access for our patients and our pediatric population across the community. Also wanted to just provide a couple of updates in regards to Holston Valley. I know top of mind for many of you or other community members, family and friends that you interact with has been previously, as a result of not only COVID but our post-COVID recovery, some of the somewhat extreme wait times we've had in our emergency departments. So I wanted to share with you where we are now. December and January were a couple of our toughest months in being able to facilitate for the appropriate access and flow of our patients into our hospital through the emergency department. I'd like to let you know, though, that starting in March, we have seen that trend go in the right direction. We are now at less than 1% of our patients who leave without being seen. So that's great in that we are seeing all of our patients. We're still trending very nicely around 3,300 to 3,400 emergency department visits a month, which is right in line with where we should be and what is projected. And also for the wait times, which have sometimes been in excess of 24 hours for a patient to get into a hospital bed, we are now less than 200 minutes on that arrival until they are actually taken up to the floor and to the nursing units. We're sitting very well below that at around 3 hours for our cardiac patients. So I know that's a question that's been raised quite often. If you're experiencing chest pain or have any other issues presenting to our emergency department. So we're very pleased with these metrics, very much sustainable. We've opened a discharge unit at the hospital, so for patients who are waiting on transport, we're able to get them safely situated in a unit separate from where their hospital bed has been, so that can still continue to allow for appropriate flow of patients up from our emergency department. So really pleased with that. If you have any issues, questions, or concerns about otherwise experiences you've had, always available to talk through that. Our patient experience scores in the emergency department as well as our inpatient at Holston Valley for March and April are the highest that we've seen even pre-COVID. So a lot of effort has gone into it, and I'll share some other good information. This time last year, our nursing turnover rate at Holston Valley alone was 33%. This month, year to date, starting last July through April, we are at 11.5%. The national benchmark for that is right around 20%. So a lot of great effort has gone into that. The wage adjustments that we experienced in our tertiary facilities has certainly been rewarding for our team, but also allowed us to recruit additional nurses in addition to retain those who are loyal and committed to our hospitals. Also, just briefly wanted to share as well, Holston Valley, as you're aware, has been known for decades for the cardiac care that's provided not just in Kingsport, but regionally. And we're pleased to announce that we are in the development phases of a cardiac center of excellence at Holston Valley Medical Center. So we are partnering with CVA and our cardiologists, cardiovascular and thoracic surgeons across our entire system to ensure that those structural heart, open heart and the more complex and acute cardiac procedures will be done in a future state at Holston Valley. So we're thrilled about that. There's lots more to come on those capital investments and what that will look like as a sustainable model for cardiac care for our system in the near future. So those are the updates I had prepared for you today. Lots of exciting things. We're very pleased to be partnering with Ballad Ventures, and as the projects that Bo described really are taking shape in Kingsport. A couple of patient stories that we've had as a result, and I'm just grateful for the opportunity to be with you today. Thank you.